Good afternoon, ladies and gentlemen. It's a real privilege to be here with such an esteemed audience and esteemed speakers who have come before me and will be joining after me as well. It's incredible to be joining you here in Dubai today and great to be spending time in person. I think we all grew far too familiar with the Zoom and Teams and other types of virtual meetings. But I think as we step back, I want to share a bit of my background, which I think is going to be relevant to the thesis of this discussion today. As the moderator kindly described, I'm a surgeon by training. I'm a reconstructive plastic surgeon. My clinical practice largely focuses on breast and pelvic cancer reconstruction. I'm also an innovator and a clinical entrepreneur myself. And having spent more than 10 years and over 10,000 hours in an operating room, I've seen the challenges that we've seen in healthcare firsthand. And so sharing with you the views of a digital future in healthcare stems both from my interest in this space, but also from a long history of seeing the challenges firsthand and trying to find problems and solutions coming together. I also lead innovation for one of the biggest hospitals in the United Kingdom, Guy's and St. Thomas's, where we treat over 5 million patient contacts annually, and we treat a huge catchment area which covers most of Southeast England. But we're here to talk about the future, how it was a new norm as we describe it. And I think it's fair to say that what we've been through in the last few years together, this new change, this new normal, has really pushed us to think about what does the future of healthcare need to look like. As a practicing clinician, seeing those challenges firsthand, it really made us think about how does a traditional model of healthcare need to evolve to enable us to support and scale. And of course, we didn't stop. Whilst the COVID pandemic pushed us into lockdown, it didn't stop us from communicating, collaborating, and sharing best practices. It didn't stop us from getting online and finding ways to communicate and digitize in order to connect and to stay connected. And I hope through those learnings we can also look at those analogies directly in healthcare. We never stopped in healthcare, and I think whilst COVID was a huge tragedy for so many of us, probably the biggest tragedies of our lifetime, seeing how many patients didn't survive, having worked in those environments firsthand, seeing just the challenges of the unknown, what it also showed us is that when we come together, we can really do miraculous things. It also showed us that by coming together, we were catalyzing the change that was needed. Digital health and we talk about digital technology in healthcare, this is not a new concept. And sometimes there's a misconception that digital just came in the last few years because of COVID. People have been talking about digital health and digital technology in healthcare for years. But what COVID did is it really stretched our systems to their core. It pushed our systems to the edge from all facets of healthcare, whether it's supply chain and logistics, being able to access patients who need to get their dialysis on time, equipments and masks and ventilator machines, and every single facet of healthcare paid a price. And so it really made us think hard about traditional bricks and mortar healthcare, and if that is truly the model as we reimagine the future of healthcare. But in that grimness, we also saw light. We saw the light of people coming together and working together and bringing together the power of the possible. By staying connected through digital solutions and digital platforms, we were still able to work together, to share data sets, to collaborate. We broke down barriers of time and space. And we were able to do some miraculous things like bring the fastest ever developed vaccines to the world. And not just one vaccine, but multiple vaccines. And it is that power of collaboration and communication, digitization that enabled that. But of course, this is one of many examples. And I will try throughout the presentation today to share and showcase some of those key examples. But what I really want to do is take you on a journey with me as we reimagine the future of healthcare. And I would also like to say, let's not call it digital health, because it's health. It's just the tools that we use to deliver it. And I apologize if these slides come up small, but I think what's important to recognize is that we saw a cluster of important digital solutions and technologies coming to the fore. And as someone that was on the front line, on a daily basis, we were reaching out to digital manufacturers, app designers. How do we create the solutions that are going to help us stay connected with our patients? Keep them safe, keep them away from hospitals. Telehealth rose significantly, more than 38 times use than it was before. And we've seen hospitals and systems completely convert to telehealth for their consultations. From a patient's perspective, they still got the care they needed. They still managed to reach a doctor when they were in need, but they were still able to do it in the safety of their home and close to their loved ones. We also saw digital solutions enable us to stay connected to monitoring patients, where patients didn't need to come into hospital to get their blood sugars checked, or their cardiac ECGs or others. We were able to deploy remote monitoring tools, Apple Watches and other systems and digital remote monitoring systems that were able to feed us the information, the knowledge in real time, and help us be better informed to manage that patient whilst keeping them remote. Now, it's useful in a COVID pandemic, of course, to have that, but shouldn't that be available all the time? Why do patients have to keep coming to hospital for the care that they need? Couldn't we reimagine a decentralized method of healthcare, where it's about prevention and action, diagnostics and treatment, where we are able to stay connected and bring all this information through these applications that make for a better patient journey and a better patient experience? At the end of the day, we have to design healthcare around the patient, not around the infrastructure and the bricks and mortar that we are so too commonly used to. It's also enabled us to think about, what does the future of prevention and management need to look like? Sending patients home early with right monitoring, cardiac management, dialysis. How do we decentralize dialysis into the field, closer to patients' communities and their homes? Where I work, patients sometimes have to travel 2.5 to 3 hours and wait for transport all day to get the 30-minute assessment that they need. We can change that. I'll take it one step further. I think in the elements of mental health, where I think it's fair to say we didn't do as good a job in the pandemic, and there's still a lot more work to do, we still managed to stay in touch through digital applications, through teleconferencing solutions, and even in the advent of VR, we were able to support them through VR methodologies, and there are a number of companies that have come out of Oxford and other places in England that are supporting that. From even as complex cases as intractable schizophrenia. We've even seen the use of VR in managing pain for children and for adults in a difficult time. And these are, of course, just some of the examples. And ones that I've been very privileged to have been involved in and seen happen, of course, is around the use of AI. As we started to aggregate data sets around imaging, around X-rays and CT scans for lungs, how could we pull that together and learn very quickly about pattern recognition and what we needed to be looking for in these scans to support decision-making, to support diagnosis, and ultimately to influence treatment? And we saw aggregated, anonymized data sets coming together through federated models, helping us leverage AI technologies in a much more scalable and accessible way with diverse data sets that can hopefully mean that we are being inclusive and digital equity is being included. But of course, I think what we're talking about is fundamentally the challenges that we see in healthcare generally of the 21st century. It's challenges around cost and access, challenges around the resources, but also making sure that the access is equitable access, that every patient, no matter where they are getting access to the best healthcare that they deserve. And as a surgeon, having worked for over 10 years in this space, having also spent over 12 years traveling to many other parts of the world looking at capacity building and sustainability in surgical care, this is a topic that's particularly dear to my heart. Surgery for far too long has been analog. The operating room or the cath lab, where we perform most of these procedures, is probably one of the most expensive assets of a hospital. High investment in devices and robotics and systems, and yet it is the most opaque environment in healthcare. We don't really know what happens. It's highly dependent on physical co-presence. We don't capture the data in any meaningful way to better influence the development and design of surgery. Everything we do in surgery depends on two people standing next to each other, and that's how we scale it. And in a world where today 5 billion people lack access to safe surgery, that's 2/3 of the world's population, and in the wealthier nations where the backlog of surgery is going to put us back at least 5 to 7 years. But even more than that, even in these countries, I can speak for the UK, and we know this in the US as well, there's still a high amount of variation. In the UK, for example, you are 14 times more likely to suffer complications in colorectal surgery between one hospital and another. And these hospitals could be 10 miles down the road from each other. Why? Because we don't capture and digitize the environment of the operating room. And as a surgeon, I wanted to change that. I want you to imagine a world where operating rooms are connected, collaborative and immersive, where we can virtually reach in and share best practices, scale up surgical teams, and shift and accelerate the need to be able to address this problem, which is one of the key constructs. 5 billion people lacking access to safe surgery is more than TB, malaria, and HIV combined. And yet it has been ignored for so long, and we don't have a short-term solution for this. We cannot magically create more surgeons to solve this challenge, and so we have to think disruptively. We have to think differently. And we have to think about how do we scale the resources that we have. And that was what Proximie was. It's a platform that we designed and I founded many years ago, aiming to connect and digitize the operating room. And we'll show a video later on to describe it. But thinking a bit more about this challenge in surgery, we also know that 4.2 million people die within 30 days of surgery because of complications and because of challenges of which 50% could have been avoided with the right expertise and the right support. Not least to say, of course, the economic effect of that, which is about $12.3 billion in lost economic output. We're not even talking about the impact this has on families, loved ones, the well-being, and all of the above. And so often the solution is let's train more surgeons. And I'm involved in a lot of workforce planning that happens in our country where they talk about how do we train more surgeons. We know it takes between 5 to 10 years to train a surgeon, and it's a vicious cycle. We need more surgeons to do more surgery. We have too much surgery. How do we make more surgeons? We have to think differently. And digital technologies can really play a role in helping us accelerate. I described Proximie as a solution. We'll show a video briefly. We've already demonstrated that we can train twice as many surgeons in half the time. Now imagine this at an exponential global scale. And of course, this is one of many examples that we're seeing coming to the fore as we start to reimagine healthcare, both primary and secondary care, but also tertiary and quaternary in the specialist centers. And so what we decided to do is to create a vendor-neutral, hardware-neutral application. It's a cloud-based application that layers in communication and augmented reality. So I could literally be using my phone, my tablet, or my computer, and I can virtually transport myself into any operating room or cath lab or procedure room anywhere in the world. I can learn from that expert, or I can share best practices. And through that, we can scale and accelerate the adoption of quality techniques and making sure that they're delivered in a quality way. And many years ago, I was inspired by an article that Atul Gawande wrote in The New Yorker about surgical coaching and the power of surgeons coming together to drive expertise. But I would take it one step further. It's not just about the surgeon. It's about the surgical team, the scrub nurses, the assistants, the anesthesiologists. Everyone in that room is part of that episode. And so how do we digitize that episode and bring it together? And this solution has now been used in over 500 hospitals around the world, some of the leading world hospitals that are connecting and collaborating on a daily basis. It's being adopted by ministries of health, by departments of health who are looking at NGO or sort of global health perspectives, like programs in Kenya and the Global South. And it's also been endorsed by the Health Education England and the College of Surgeons. So I'll show you a video, hopefully if it plays, and with audio that gives you just a perspective of how that stays connected. What's important to me is that Proximie's platform is used all around the world. Whether you're in the most advanced teaching hospital in the center of a big city in the US or in the UK or Europe, or you're in a small community hospital in an area that has one specialist across the whole population, we need to all be able to have access to that solution. Imagine that connected surgical care continuum, pre, intra, and post-op. Solutions and technologies coming together, integrating across an OS, and Proximie being that OS of the operating room, enabling connectivity, collaboration, data and analytics and intelligence, turning these rooms into smart ORs, taking surgery beyond the operating room.
We have 69 different countries, so it's such an honor, and thank you, Proximie.
So again, we've got the globe covered, and we're all in the same room watching this procedure.
I tend to put two, and this one, I mean, just from a gravity standpoint, I'll stick on that so-called gutter if you want, and then this side I'll put on the other gutter.
Okay. The one thing, now that I have an annotation device, which I love,
oh wow, I love it. I wish it was your real hand. Yeah, so that if the patient is twisted in a left-sided position, that you know where 6 o'clock is. Yeah, so that if the patient is twisted in a left-sided position, that you know where 6 o'clock is.
So this is the plane. Here is the pancreas.
Ah, yeah, just a little wink of it,
It's our
didn't
friend.
we? Yeah.
I always say the pancreas is our friend because it always gets such bad press in the colorectal world.
It is a very sophisticated technology, but very much user-friendly, particularly for somebody like myself who gets scared about new technology because of my age, really.
Actually seeing and testing the model, I just thought that it was an amazing tool. We need something like this to help us advance our skills, to help us continue to perfect our work.
Let's move it along in the interest of time. Now, of course, what's really important to recognize is that what we've described so far is akin to a lot of disruption we've seen in other sectors as well, both in healthcare and outside of healthcare. The key fundamental tools are around communication, connectivity, data, but also the interface between these solutions and humans. And what does that human digital or human robot or human device interface look like? So we talk about connectivity. It's difficult when you try to deliver these solutions when we don't have the base or the devices to use it. But if we look around the world today, over 8 billion people are carrying a smartphone. And connectivity is becoming far more ubiquitous all around the world, whether it's through 3G and 4G, 5G even now. I've heard about 6G in the last few weeks. But we've even heard about space tech, like Elon Musk's team are looking at low-orbiting satellites, on-the-edge computing as well. And so as we start to make sure that these solutions are ubiquitous, it means that we can truly find the ways to stay connected. And we saw this, of course, with COVID, as people use their devices to stay connected through Zoom and Teams and all these other applications. And by staying connected, we break down silos. We break down barriers. And most importantly, and you heard it earlier from the speakers, it's about multilateral discussions and connectivity and communication, sharing data, sharing knowledge, and sharing information in a meaningful way. And as we start to get more comfortable with these solutions, sharing them cross-culturally and across multiple nations to pull these federated sets together in a meaningful way. And it is through this digital enablement, through connectivity and communication, that we can then bring in the other key element, which is data. Data empowers us. It enables us to think more innovatively and how to direct resources to where we need to take them. As I told you, the operating is opaque, and we don't understand really what goes on there. But imagine we knew what was going on in every operating room. Every case that was charted, every audio, every voice, we were able to pull that to better understand what happens. I would say the same is fair about every part of healthcare, primary care, secondary care. And we've seen the advent of data really change and reshape a lot of elements, such as radiology and genomics and other testing as well. We've also seen its use across, its discussion across the WHO that's been talking about data at the center of policy. And it's something that I would urge us to get more and more comfortable with the right governance structures as well. And it is through that data that we're able to standardize care, codify the delivery of care, and therefore direct resources where they need to go. It's also about taking that data and turning it into action. Data is a raw material. Having an abundance of data sets doesn't necessarily mean that you're more empowered to make that change. But how do we then start to turn that data into meaningful action? And we've seen lots of elements where we've been able to leverage that data to better understand our operating rooms, to better understand our costs, to better understand efficiency, but also to be more precise in the care that we're delivering for our patients. It isn't a one-size-fits-all. And with the right information and a diverse data set that is equitable, then we are able to truly change the paradigm and look at how we can turn this data into action. And we've seen a lot of incredible technologies coming out that are pulling monitoring data, that are pulling imaging data, and a whole host of other areas to try and see how do we reshape resources and delivery of care. And our healthcare workers aren't afraid of this. 97% of healthcare workers in a survey reported that they believe that AI and data and solutions can play a meaningful impact in healthcare. And so let's not shy away from it, but get comfortable and embrace this continuum where we see the influence that data can have in digitization in the delivery of care. And finally, and most importantly, as a practicing clinician, I want to reassure everyone that I'm not advocating that digital solutions or devices replace clinicians. It's often a fear that we hear from people that we're talking to about the future of healthcare. I see them as a combined effort, augmenting each other hand in hand. If we're able to bring these solutions together, we can free up doctors and their teams to spend more time with their patients rather than spending hours trying to sift through notes and documents. If we can bring this together, we can accelerate the delivery of care for patients so they're not waiting months and months for the care that they need. And if we can bring these things together, we can make a human device interface actually feel like a real touch. And you would have seen in the video that I showed, we brought an augmented reality into the experience because we wanted it to feel humanistic. If it was just digital, we would have left the digital tools and that's it. But bringing in the AR makes you feel that you're in the room, makes you feel immersed in that environment. And of course, this is one of many examples. Similarly, we often get asked, will robots replace surgeons? Again, I want to reassure you, that's not going to happen. What robots are there to do is to augment the surgical team, to enable access to difficult parts of a surgical anatomy where you can actually have a better chance of success, higher, quicker rates to discharge, and ultimately deliver a better experience for patients. Now imagine robotics combined with digital solutions like this. And I will share an example that happened actually within my own hospital at the height of COVID. It was April, May, after the announcement of the pandemic. And we had a young 31-year-old, Muhammad, who had metastatic testicular cancer. He'd just undergone chemoradiotherapy, and the cancer was wrapped around his aorta, or the vessels in his abdomen. This is a very difficult procedure. The access is important, and traditionally, we would have done it through an open procedure. But the risk was Muhammad would have to stay in hospital for 10 days to 2 weeks and on intensive care, with a high chance of catching COVID as he was immunosuppressed. So what did our surgeons say? We need to do this robotically. We have very well-trained robotic surgeons who have the right skills, but this is not a case that they have seen commonly. We're going to bring in an expert to work with us on the case. And they dialed in Jim Porter from Seattle, who dialed into that case, and they worked together. 4 hours later, the patient was on the wards. 3 days later, he was home. And 5 days later, he was on TV having an interview talking about how privileged he felt to have the opportunity to have the surgery that he much deserved and be left safe and go home. And so when you put the human stories around it, it no longer feels cold and unemotional. There's actually a human at the end of it that is benefiting. And I know I'm getting close to time, and of course I could talk about this forever, but I just wanted to end with, this is something I'm very excited about. And leading innovation in my hospital and driving my own solution, Proximie, I have seen the potential and the impact firsthand. Through my technology, we have touched the lives of over 30,000 people. We have saved an immense amount of carbon footprint, and we have been able to scale the delivery of surgical expertise to everywhere in the world. We've been used in all 5 continents. But as we talk more broadly about digital, I want you to know that I truly believe, as I'm sure all of you do, that the human and the patient is at the center. But by bringing these solutions together, remember these words: decentralized. We need to shift from bricks and mortar. Integrated. We need to collaborate more and bring global expertise to wherever it is needed. It's about multidisciplinary. It's about agility. And ultimately, it's about making sure that every single person gets the best quality care, no matter where they are. And I will end by saying, although my title said the digitization of healthcare, in my perspective, it is the future of health. It is health, and we need to reimagine that future of healthcare together. Thank you.